legal and fiduciary duties of the board. So when we think about the board's role during times of crisis, there are some foundational duties. There are some foundational responsibilities that boards have in all times, but certainly also in times of crisis. Where we're going to spend the bulk of our time is on the board's sphere of influence. So when we get questions from board members, when we have issues that come up of boards either paralyzed or boards acting rashly during this time, it's helpful to focus on what is the board's primary spheres of influence. What are those areas that in times of crisis, they can make the most unique impact or influence on? And then third, we're going to finish up by talking about some tips from my perspective for fostering board engagement. So I told you a little bit about my background at the outset. I also served as a nonprofit CEO for a little over a decade. So when I have served as a board member as well, but when I discuss these topics, I particularly come at it from the perspective of someone who has been a nonprofit CEO, who has had to work with boards in various stages, in various states of effectiveness and dysfunction and paralysis to action. So I do have some experience here that I will bring to the table today. I do want to start though with a brief poll. I'd like to know from you all, and you can use the polling feature that pops up on your screen right now. If you could please describe your role in nonprofit organization that you're with right now, your primary organization. Are you the CEO, executive director? Are you a staff member? Are you a board member, or are you a volunteer? And that'll help me as we go through the webinar today. I'll give you just about 5 to 10 seconds to let those polling numbers come through. I see them popping up right now. Okay, we've reached the point. I'm going to publish those polling results. It looks like we are heavy on board members today. We have 50% of those who are attending the webinar right now are serving on nonprofit boards. We have 33% of CEO, executive director, 23% staff member, and a smaller number, 7%, who are volunteers. So I appreciate you sharing that information with me. It helps as we go through the webinar today. Where I want to start is with the 3 key roles of the board. And as you know, these apply in any time, but certainly in times of crisis, these responsibilities, these obligations are heightened. And the first is to set an organizational direction. So while the CEO, while the executive director and the staff are most likely head down in the weeds right now, working on the day-to-day operations of the organization, trying to manage staff, trying to maintain communication with volunteers. It's the board's role to continue to keep that strategic direction in mind of how to operate at 30,000 foot level. What are the key macro issues that the organization needs to pay attention to? Second is to provide oversight and support. And I add that second word in there deliberately, support. It is so important right now for board members, and if you are a board member, I highly encourage you to do this, is to provide support to your executive director and their staff members now. Even if it's a brief note, a text, a phone call, a thinking of you type message, critical role for the board right now is to provide that level of support for the team. And then third, and what is certainly at the forefront of the minds of board members and staff members right now, is ensuring adequate resources. So making sure that the organization has the resources it needs to function during this time of crisis, to manage the staff and to move forward as best they can and make decisions accordingly. I told you I would touch on the board legal duties, and I'm gonna touch on this just briefly. Many of you who are on the webinar know that I'm an attorney by background, so I would be remiss if I didn't at least mention the board's legal duties during this time. And that at the top of the list is the duty of care. And what we mean by the duty of care is that the board is exercising reasonable care in making decisions to benefit the organization. So this is not a time for the board to be completely disengaged. This is not a time for the board to disappear. Rather, the board is going to be called on to make some critical decisions about how the organization moves forward. What do we need to do to protect our staff? What do we need to do to protect our finances? How do we address any damage to our revenue streams during this time? In order to do that, the board has to be informed. So in order to fulfill their duty of care during this time, the board has to pay attention. The board has to stay curious. The board has to ask reasonable questions of the executive to make sure that when those decisions come up, they have access to the types of information that they need in order to make an effective decision. The second legal duty the board has to pay attention to during this time is the duty of loyalty. It is impossible to ignore the fact that board members are like any of us in that they have a number of different competing priorities on a personal level, on a professional level, with their career. But in order to fulfill their legal duty, their duty of loyalty, they have to make sure that as they make decisions for the organization, that just like in any other time, those decisions are free of conflicts of interest. So there is no bias, there is no conflict, there is no personal or professional interest that is getting in the way of the board member's ability to make a reasonable, informed decision that benefits the interests of the organization. And then third is the duty of obedience. So even though we are in a time of crisis and we may need to amend some of those bylaw provisions or suspend some operational provisions that we have during normal times, it's also important to be faithful to the core mission, to the integral parts of the mission of the organization during this time. So I promise with that, we have reached the end of the legal duties and fiduciary duties for the board. We're going to move forward into some of the other conversations that we want to have. I saw an article recently in the Chronicle of Philanthropy that I thought was fascinating. It was fabulous, and it shared a framework of sharing with your board what type of organization are you right now, because we'd be naive to think that every nonprofit organization is impacted in exactly the same way during a crisis, particularly the COVID-19 crisis. So the article, and I forget the author's name right now, but you can look it up in the Chronicle of Philanthropy. The author of the article gave us a paradigm of 3 different types of organizations. There are the hibernators, there are the responders, and there are the hybrids. So let's take each of them individually. Hibernator organizations right now are those whose operations, their programs, are completely shuttered during this period. If you think of, for example, many arts organizations that I've spoken with recently, they are event-based. All of their programs, all of their operations, things that they do on a daily basis are essentially shut down during this period. They're in hibernation. The decisions that their board has to make, the decisions that their executive director is forced to make, are likely going to be very different than responder organizations. And responder organizations are those who are on the front lines right now. Perhaps they are health and human services nonprofits. They are providing services for the homeless. They are providing services for healthcare workers. They are at the front lines of dealing with the COVID-19 crisis. So it's important to understand that their board is likely making very different decisions, having very different conversations than hibernator organizations. And then third, which is most likely the bulk of us, the bulk of nonprofit organizations, are those that are hybrids. Those that are not fully shuttered, but have certainly had an impact, have certainly had to close some programs or suspend some programs, but they are not fully on the front lines. They are not in the healthcare field. So they're likely straddling the line between figuring out what programs they need to suspend or pull back from and what programs are most critical, mission critical during this time. So as you talk to your board, as a board member, one of the first conversations that you can have is, what type of organization are we? How has this COVID-19 crisis impacted us most profoundly? As we move to the next slide, I have spent countless hours over the past couple of weeks talking to nonprofit leaders and board members about the responses from their board during this time. And it really, just like anything else, it falls on a spectrum. And if you look at the horizontal axis of the spectrum there, you have boards that are completely disengaged. We have some boards who, just because of the gravity of the situation or the competing demands on their time, have essentially gone into a paralysis mode. They have either disappeared, the executive director has not heard from them. I spoke with an executive last week who said, this has been going on for weeks and I have yet to receive a response to a single email that I've sent to my board. So that's obviously a board that's completely disengaged. On the other end of the spectrum, we have boards that are extremely engaged right now. And there's no judgment applied to either end of the spectrum here. When you have a board that is fully engaged, you have to make sure, is that engagement positive during this period, or is that engagement negative? So if you take a look at the different quadrants, and again, this provides another paradigm for you to have conversations as a board, is where is our board showing up right now? What are the responses that we're seeing? So if we are over on the engaged end of the spectrum, and we want to stay up in the positive end, what are the types of things that the board is doing there? And that's what we're going to talk about as we go through the rest of the webinar. That's a board that's having strategic conversations, that's supporting the executive director, that's focusing on safety, that's maintaining positive lines of communication back and forth between the community, between the board, and between the staff. On the negative side, boards that are engaged can also be exhibiting negative behavior. So these are boards that may be making rash decisions, that may be blurring lines between board and staff, that may be having in their zealousness, in their desire to have a bias toward action, are acting rashly and making quick decisions that may not be in the short or long-term interests of the organization. On the other end of the spectrum, we have disengaged boards that obviously can also exhibit positive behavior, meaning we are here in the background if you need us to the executive, or negative, and that is the board that has largely disappeared. So when you think about your board's response, and as you reflect on the way in which your board has responded to this crisis, one of the effective diagrams or paradigms that you can use to have conversations is, as a board, let's talk about where each of us thinks that we are. So from the executive's perspective, this is how I've perceived the board's response. We have been tilting towards the engaged, and here's how we've been positive, and here's how we've been negative. And the board may have a slightly different perspective on that, but the value of a tool like this, the value of a diagram like this, is in the conversation that it spurs. So as an organization, it's important to keep those lines of communication open. You see the image of the rowboat on the next slide here, and that's really, as we move forward through a crisis for nonprofit organizations, between board and staff, it's important to row together. So what happens if we're in a rowboat and we have one side, one oar, that is aggressively and assertively and rowing in an assertive fashion, and the other side is completely disengaged, not rowing at all? We're going in circles, right? It's the same thing for us as an organization. We have to row together. So while the board is focused on the strategy, the higher level operations of the organization, procedures, policies, things like that, the executive is worried about the operations, the day-to-day management of the organization. So what I'd like to do is just offer that as a metaphor for you, to say that as you talk to your board, as you think about moving forward, to what degree are you rowing together? To what degree are you functioning as a well-oiled machine during this time? To what extent you may need some help in that area? So for the boards that are disengaged, and I spoke with a board chair last week who admitted that their board was completely disengaged during this period of time. And the response when pressed on that was, you know what, there's not really a role for us as board members. We feel like the staff has it. We don't want to get in the way. It seems like this is more of an operational crisis. There's not much for us to do during this period of time. And I push back on that line of thinking, and I think one of the ways to get around that is to focus on what are the core areas that are within the board's sphere of influence. So what are the key areas that the board can make an impact in uniquely? So obviously there are other areas that the executive and the staff are working on, but unique to the board's role, what are their spheres of influence? And I break it down to 5 here. There's safety and support. We touched on the support issue. We'll talk about organizational safety as well. It's a core board responsibility to make sure that as the staff continues to work, as the leadership continues to work, as we continue to use volunteers, that we do so safely. So that's the first priority of the board during this time. Second is plans and policies. So as all of us have adapted to a new reality of working remotely, of having to understand what is our remote work, our telework policy, what's our business continuity plan. A key role for the board can take a look at what do those policies say now, to what extent do we need to revise those policies, to what extent do we need to write those policies from scratch, and to what extent do we need to completely revamp it because this is such a unique situation for our organization. So again, policy review, plan review is another key area that the board can be involved in during this time. Third is communication. So to whom are we communicating? By what channels? What are our key talking points? And how frequently are we communicating as an organization? I was talking to an expert the other day in the communications field, and rightly they pointed out that the organizations that communicate most effectively during this crisis, as a board, as a staff, to volunteers, to donors, to those that the organization serves, are the ones that are going to build trust for the future. So when we come out of this on the other side, those are the organizations that are going to have built up the most trust, the most community awareness for being a trusted partner. So as a board, understanding what is our communication policy, who speaks for us as an organization, what channels are we using to communicate, and how can I amplify the message of the organization as a board member. Fourth, and we'll spend a fair amount of time on this in the webinar, is finance. So how can the board understand the financial condition of the organization, make decisions accordingly in conjunction with the CEO, with the executive director and staff, and then also remedy any damage or address any damage to revenue streams for the organization. And fifth, and we're not going to address this individually, but it shows up in each of the other bullet points, is equity. So for many organizations, for most organizations, equity is a core value. As you make decisions during this time, the board is uniquely positioned to elevate and to use a lens of equity in making those decisions. And we'll talk about that, particularly when we think about issues of which programs do we suspend, which programs do we invest in during this time. As we think about remote work policies, are we using an equity lens that understands that not all staff members have the ability to work equally from home? Are we addressing our expectations? Are we providing the types of tools, equipment, materials, and resources to our staff, to our volunteers, so that they can be effective with their unique situations during this time? So we're going to talk about each of those areas individually, but at a high level, the 5 areas that the board can most be involved in, can most make an impact during this time, are safety and support, plans and policies, communication, finance, and equity. Another strategic framework that I like to use with boards in any time, but particularly in a time of crisis, and it provides an overall framework for us to make decisions within each of those areas that I just mentioned. This comes from the Center for Community Investment. I just saw this the other day, and I want to give them credit as a source for this framework that I've adapted here. So you see 4 different quadrants. So as a board, as you as an executive director and board are making decisions together, there's a framework and a lens that you can use that's helpful. So you see in the top left-hand quadrant there that's highlighted green, those items that are a current priority, that are still relevant, and have to move forward during this time. So these are the things that, for lack of a better term, are mission critical. So even during this time of crisis, these are the items that we are going to most focus on. The precious resources, the limited staff time, financial resources that we have, we're going to make these items a current priority. Second quadrant there that you see in yellow on the top right is items that we're going to pause and resume when the crisis ends. So these are items that we still want to be part of our organization. These are programs that are still important to us as an organization, but we just don't have the bandwidth for them right now. These are not mission critical priorities right now during the crisis period. So for those programs, those services, we're going to pause them and we're going to put them in the bucket to resume when the crisis ends. Moving down to the bottom left that you see in orange, there might be some items that are suddenly emerging priorities. So I've talked to a lot of organizations recently that have said, you know what, this program was something that we had conceived of in the past, but had been kind of on a shelf. We had never really invested in it. But boy, right now, during this crisis, it is more important than ever. We're going to elevate that to an emerging priority, and we're going to invest in it accordingly. And then finally, on the bottom right is those programs, those aspects of the organization that right now are unknown. We need more data or info before we can move forward, or those programs that we're going to honor and let go. Because of financial realities, because of capacity realities, we don't have the ability to invest in those, and in the short and medium term, we don't see a path forward for those. We're going to let those go. So as your board takes up strategic conversations and discussions of how do we move forward, what programs do we invest in, where do we have to make some cuts, I suggest to you this framework because it provides a lens. It provides the ability to spur conversation and spur discussion of, is the topic that we're talking about right now a current priority, something we want to pause, an emerging priority, or something that we need to just let go for right now. The first area that I mentioned to you earlier that the board can have a particular impact on is safety and support. And we talked about the ways that the board can show support for the executive director and the impact that support can make. But safety is another area. And a couple of questions that I would suggest boards ask and executives pose to boards when they get together. Number one, what specific aspects of this crisis affect our organization? The more a board can be clear on the specific aspects of the COVID-19 crisis that are affecting our organization, the more they're able to make informed decisions, the more they are able to and empowered to engage. When we just think about things in the abstract, we think about, boy, this has had a big impact on our nonprofit. If I don't know the specifics, if I don't know in what most critical ways this has affected our organization, it's tough for me to understand how to respond as a board member. How can I use my unique talents, my unique gifts that bring me to this board to most effectively make a decision? Second is, what are our greatest vulnerabilities? This goes hand in hand with the third bullet point there, which is the scariest questions. So anytime we have turned on the TV recently, we have seen, whether it be corporate leaders, whether it be government officials, we've seen them holding press conferences. And we've seen the ability of the press to ask questions. So another way to put greatest vulnerabilities is, if we were up there behind the podium, if we were at the microphone, what are the scariest questions for us to have to address? What are those questions that we might not want to get asked during this period? That provides a sense of priority, a sense of how can we elevate those scary questions, those greatest vulnerabilities, to the forefront of our discussion so that we are making decisions with the greatest level of priority during this time. We're addressing those questions, those vulnerabilities that are most pressing today, and we can continue to address those and continue to checkbox those and move down the list. And then finally, how can we prevent the worst case scenario? So understanding as an organization, what would be the worst case scenario from this crisis now, within the next 30 days, within the next 30 days, allows us to then have strategic conversations about how do we remedy that? Can we remedy that? What resources do we need to put to that? How do we leverage the talents of the board, the talents of the staff, and what are we doing to manage our volunteers around that? Another way of thinking about safety and support is managing risk. So here are a couple of different ways that we can, as a board, as an organization, manage risk during a crisis. Number one, and we touched on this earlier, is communicate frequently. The more we understand what's going on a daily basis within the organization, the more that line of communication is open between the board and the executive, the more effective we can be at managing and mitigating risk. Second is act with prudence. So we don't want to be that organization. We don't want to be that board that's completely disengaged, that is paralyzed. But we also don't want to be that board that is acting rashly, that's acting without full information. As many of you know in your private lives, in your careers, legislation is being passed at a rapid level, at a rapid rate, and it impacts the nonprofit community profoundly. So taking steps to understand the landscape that's out there and then commit to action. So taking taking care that you're not paralyzed, you're not making sure, not letting perfection be the enemy of the good, but understanding what does the landscape look like, what does the legislative piece look like, and then how do we respond accordingly? What is the best decision that we can make, the most effective decision we can make at this time? Third is to check your business continuity plans. We'll talk about that in a minute. Fourth is run risk scenarios. So I talked to one board that was effectively managing this situation the other day, and one of the things that they had done is they had established a short-term task force of 3 board members, and those board members were responsible for running various risk scenarios. So communicating periodically with the executive director to understand the risk to the organization, run various scenarios off of that risk so that they could then communicate back to the board as a whole. Here is what we think the risk looks like today. Here is what we think the risk may look like tomorrow. That gives the board the type of information that they need to make critical decisions. Next is a remote policy, and we'll talk about the elements of that in a moment. Volunteer impact, and then supply chain. So for us as an organization, how has this crisis, if at all, impacted our ability to get the types of supplies and materials that we need to function as an organization? So I'm not going to delve deeply into the legislative piece, but I do want to highlight it because it's important for boards to understand principally the 2 key pieces of legislation that were passed, which were the Families First Act, HR 6201, and the next, which was the CARES Act. So the Families First Act had key employment provisions, which included 2 weeks of emergency paid sick leave, 12 weeks of family and medical leave, and reimbursable payroll tax credits for nonprofit organizations. For more information on that and detailed explanations there, I know many of you are inundated with information on the pieces of legislation. The National Council of Nonprofits has put together some really important and really thoughtful information sheets there. So I would direct you to National Council of Nonprofits there. The Families First Act also included other major provisions. So if you are an organization such as many of our food banks that are out there that are dealing with SNAP or child and senior food and nutrition, there are provisions in the Families First Act that you'll want to be aware of there. Emergency unemployment provisions, and the fact that COVID testing and treatment is now being treated as free, or particularly the COVID testing is being treated as a free service. Next is the CARES Act, and I will confess I have spent more hours than I care to note on the payroll protection program, loans, and walking nonprofit organizations through the process for the Payroll Protection Act. But if you are a nonprofit organization, whether you ultimately decide to apply or not, it is critically important that as a board, as an organization, you have conversations about the CARES Act and whether it's something that can benefit your nonprofit. Because I've spoken to many nonprofits that had ruled it out, that had thought, you know what, this doesn't really help us, or I don't know if this applies to us. But once you were able to talk it through, once you're able to understand the program better, it can provide relief for organizations, but there are certainly pitfalls to avoid. So understanding the CARES Act, the Payroll Protection Program, the EIDL loans is critically important. Understanding eligibility. So at a high level, eligibility is limited to organizations that have 500 or fewer employees. It's important to understand about the Payroll Protection Program that there is no personal guarantee or collateral required in order to qualify. The amount that you can ask for is the lesser of $10 million or 2.5 times the average total monthly payroll of your organization. And there are certainly resources out there that will help you understand how to calculate those amounts. The use and forgiveness provisions, the devil is always in the details when it comes to these programs. And so understanding that, having conversations at a board level about the CARES Act, if that is something that would benefit your organization, I do urge you to reach out to me, and I'll give you contact information at the end of the webinar, or to someone in your community. I know we have folks on the webinar today from all over the country and some even internationally as well. But understanding, for those of you in the United States, the provisions of the CARES Act, how that may or may not help your organization is critically important. I do see a question that came in just now that I do want to answer, and it's about the payroll protection program. It's a question about, is the payroll protection program applicable to 501c6 organizations? And that's a good question. It is not applicable to 501c6 organizations. It's limited to 501c3 organizations at this time. So I highlight and underline and italicize at this time, because just like most legislation that's passed quickly, it's still a rapidly evolving environment. So there are regulations that are being written and rewritten as we speak on a daily basis. There is also significant discussion right now of CARES Act 2.0. So there may be a second version of the CARES Act, and if so, we don't know what the provisions or how that may change under a CARES Act 2.0. Good question, though. Also understanding the economic injury disaster loans, how unemployment is treated for your organization. If you are self-funded in your unemployment, that's going to be different than nonprofits that pay into their state unemployment system. The next one is the one I want to highlight. Under the CARES Act, there is a new charitable giving incentive of up to $300 above the line as a charitable giving universal deduction. So understanding that charitable giving deduction gives you the ability to communicate to your donors. As a board, gives you to communicate to fellow board members about a new incentive for charitable giving, as well as they have lifted the cap on charitable giving for high net worth individuals, or those individuals who are itemizing on their tax return. And again, this isn't a webinar about the CARES Act or about charitable giving per se, but I do want you to be aware of the charitable giving provisions that are out there. Another question that came in is, how do PPP forgiveness and federal or state funding relate to each other? I would like to give you a comprehensive answer on that, but the short answer is it depends. It depends on what type of state funding we're talking about. Generally, if you are an employee, or if you are a sole practitioner, or you're self-employed, or as a nonprofit of one, you can't double dip. So if you are participating in taking unemployment at the state level, you can't also receive payroll protection as a sole practitioner. But that's just a one-person case. The longer answer is it would take us a lot longer to delve into all of that. I want to move to understanding as a board, or how you can help your board understand how to plan from a business continuity standpoint. One of the things I've been telling folks lately is the COVID-19 crisis has exposed vulnerabilities within each of our organizations that have largely always existed. It's just that in times of crisis, they're amplified. So for many organizations, they've realized and come to the scary realization that they may not have a business continuity plan, or they may not have a business continuity plan that is that it accounts for situations like we find ourselves in right now. So I've been working with a lot of nonprofits about how to develop their own business continuity plan. And at a high level, there's really 4 parts to it. There's a communications plan. So who speaks? How do they speak? What channels do they use to speak? What do they say? There's essential functions. So how do we as an organization define what are those essential functions for us? What's mission critical? Third, what programs and services do we need to temporarily halt during a time of crisis? And then fourth, what is our plan to resume normal business activity? So I'll delve into each of those in a little bit more depth, but at a high level, a business continuity plan includes a communications piece, an essential functions piece, a what do we need to put on hold during this period, and then what is our plan to resume normal business activities? Let's talk about it in a little bit more detail. So if you think about a business continuity plan, and this is for example, a sample table of contents for a business continuity plan. First is, what is our employee assistance plan? During a time of business interruption, what employee assistance provisions do we have from a safety standpoint, from a benefits standpoint, from an access to help and services standpoint? How do we as an organization prioritize the risks that we face? Who comprises our business continuity team? What are our critical assets and operations? What technology do we have? What's our inventory? How do we maintain security? So how do we maintain business intelligence security How do we maintain HIPAA compliance? So if we're now suddenly all working remotely, how are operations impacted that way? Do we have or need a temporary location? What is our notification chain for business interruption events? What are our key contact numbers? So if we're thinking about a chain of people that need to be contacted, making sure that all of their contact information is located within our business continuity plan is obviously essential. And then what insurance provisions do we have? So putting this information, packaging this information into a business continuity plan allows your team, allows your staff, allows your executive to focus on the things that are most important today, not trying to figure out each of these additional pieces on the fly. So as a board, one of the most critical things that you can be engaged in right now is reviewing your business continuity plans, revising where necessary, revamping where necessary. Many of us are adjusting to a new reality. You see me broadcasting, obviously, from my home office to a remote work environment. And many nonprofits are having to figure out what that means for them, what that means for their staff on the fly. They may not have a remote policy. This may not be something that you've had to confront in the past. So when we think about a remote operations strategy at a high level, at a strategic level that the board has visibility into, what are the expectations of the executive, of the staff during this time? What training and support are we providing to managers on how best to lead virtually? We have talented staffs. We have talented people in leadership positions. They may not have specific experience, though, on leading in a virtual environment. What training, what support can we provide to them as a board, as an organization, meaning resources, to help them lead in the environment that we're functioning in right now? What are any needed technology programs or apps that'll help? And again, this is an area to keep equity in mind. Not everyone on your staff is going to have access to a home office, the ability to work privately, the ability to work a traditional 9-to-5 day. What provisions do we need to make to keep equity in mind and provide individuals with the support, the flexibility, and the resources they need to be successful? Someone may need a laptop at home. Someone may need an iPad. There may be programs and apps that we need to purchase as an organization that puts our people in position to be successful. And if you take nothing else from the webinar, the board's role at this time is to put the staff, put those that you serve in a position to be successful to the greatest extent possible. Elements of a remote policy. So if you're having to build this from scratch, thinking through how does the remote work environment impact compensation decisions, work hours, who's eligible? Is it applying to the entire staff or just some subset? What equipment do we need to provide? What are our workspace, privacy, confidentiality concerns? How are we going to provide office supplies? So are individuals responsible for providing their own office supplies and being reimbursed? Or is the organization sending or providing in some way the needed office supplies to get the job done? Understanding the provisions of your workers' compensation policy. So understanding that individuals who are working from home, still in the context of providing services relevant to their job, are covered by your workers' compensation policy. Liability, taxes, how are we going to communicate? And then how does this impact people's ability to be evaluated? So if you are used to providing a face-to-face monthly evaluation or every 6 months or annual review, understanding in your remote policy, how does this impact your ability and the frequency with which you're going to provide evaluation? So after safety and support, the second area that the board can be critically involved in is communications planning. So for many organizations, this involves putting together, for example, a media strategy, a press kit. So if we are an organization that is responsible or that is going to be asked questions by the media, understanding what that looks like, what is our press kit, what are our talking points, who speaks for the organization, and through what channels do they speak. Second is the logistics for an emergency board meeting. So as a board, one of the things that you can be paying attention to is if we need to meet as an organization quickly, if the dynamics on the ground change and we need to hold an emergency board meeting, how can we provide for that now? So that in the event we need to activate that plan, we're ready. We understand it. We know where we're going to meet. We know the platform and the tool that we're going to use to meet as an emergency board. Again, that goes into communications planning. Key stakeholder contact information. Again, in the event of an emergency, we don't have time to be searching for board members or key stakeholders, phone numbers, or emails. Getting all of that compiled into a communications kit now is critical. Essential policy statements and FAQs. So to the extent that you as an organization can anticipate and provide answers to frequently asked questions during this time, the more effective your communication strategy can be. The third area of board involvement is financial management. And here is another place where I want to recommend and suggest an article to you. My friend and colleague, Steve Zimmerman, who was recently on the podcast I host, Nonprofit Vision, wrote a brilliant article in my view, and the title of the article is From Sustainability to Survivability, 5 Steps Nonprofits Must Take to Survive the Coronavirus Pandemic. And the 5 areas of board engagement that I have on this slide are adapted from Steve's article. I thought he did a fabulous job analyzing the ways in which boards can be involved from a financial management perspective at this time, and I've adapted these from his 5 areas. The first is understanding the cash position of the organization, and we'll walk through each of these. The second is assessing the damage to the revenue stream. The third is ensuring balanced decision-making. Fourth is around ensuring voices are heard, and the fifth is around advocacy. So when we think about the first area that many boards are concerned with, rightfully so, is what is our cash position? So understanding what does our cash look like today, and how does that impact our ability to continue operating, continue surviving as a nonprofit organization during this period. One immediate way to understand that is to understand your current ratio. So at a quick level, and every organization, every nonprofit can do this and provide this to your board. Your finance committee may already do this, is taking a look at what is our cash in the bank divided by our monthly expenses. So that's going to give us what we call our current ratio, and that'll tell us at a high level how healthy is our cash position. So if we have $2,000 in the bank and we have $1,000 of monthly expenses at a really quick level, that tells us if nothing else happens, we have the cash to exist, to sustain ourselves for 2 months, right? And that's going to factor into the board's ability to make decisions. Do we have to make staffing decisions, cutbacks? Do we need to aggressively or assertively go out and try to acquire additional resources? So again, for a board, understanding what is your immediate cash position and the current ratio is a great way to understand that. Also, a longer term way to understand your cash position is boards may wonder, well, what's our liquidity look like during this time? I understand our short term cash position that we have cash on hand for 2 months or 3 months or 6 months. What's our longer term liquidity look like? So a way to understand at a board level that your liquid reserves is to look at your cash plus your cash equivalents plus any accounts receivable, AR, so amounts that are out there that you reasonably think you'll collect, minus any restricted funds. So for many nonprofits, you have restricted funds, restricted grants, subtracting those out of your liquid reserves calculation. So it's cash plus cash equivalent plus accounts receivable divided by your typical monthly expenses. Again, that's going to give you a broader picture of, in the medium term to the longer term, what is our liquid reserve as an organization. Second is you can assess the revenue stream damage for your organization. So as an organization, for many nonprofits, your funding typically comes from one of these buckets: from program fees, fees for service, event revenue, so for those that are either fundraiser event or other event based, grants, and donor support. So as an organization, having those critical conversations about, with each of these streams of revenue, what does our typical pie chart look like? What does a typical circle look like for us? And then during this COVID-19 crisis, how are each of those slices of the pie impacted? Again, you see as we go through this, a focus on strategic conversations in the boardroom. So again, pushing back on that board member who said, you know what, this is essentially a staff issue. There's nothing for the board to do during this period. All of these conversations are vital. They're critical to have, and they're critical for the board to have accurate information and keeping that flow of information going. Also important in assessing your revenue strategy is to mitigate the fundraising loss. So anyone who has been online, who has been on social media recently, has seen the question posed, is this a time where we should continue to fundraise, or is it inappropriate for us to fundraise during this time as an organization? Does it look opportunistic? And my answer to organizations, again, everyone answers this differently, is this is absolutely a time where not only should you fundraise, but you must fundraise. For many nonprofit organizations, the COVID-19 crisis represents an existential crisis. There is legitimate fear and concern of whether organizations are going to continue to exist on the other side of this. One way to mitigate that is to engage in effective fundraising during this period. Ways you can do that. You can keep your donors informed. There is nothing more powerful during this time than building relationships. Obviously, you don't want to start with an immediate ask in line one of your first communication to a donor. But this is a great time to reach out to those who've been supportive of your organization in the past and check and see how they're doing. How well do you know, put another way, how well do you know your donors? You know, I mentioned before that crisis reveals things about an organization. One of the things that it reveals in a fundraising context is how robust is the relationship that you have with your donors. Do you know their family members? Do you know how many kids they have? Do you know what line of business they're in? Are you able to engage with them at a human level to say, hey, Jane, how is your business doing? How are your kids handling this? I know school at home must be difficult right now. To what extent can you continue to build authentic relationships with your donors? Again, those are the nonprofits that I believe are going to be most successful coming out of this crisis. Second is you may need to explore asking permission of donors. So for some donors that may have made restricted gifts in the past, if your organization reaches a dire cash position, you may need to have conversations with that donor. Can we lift that restriction? Can we redesignate some of those restricted funds for operations? Would you consider a one-time gift or grant to our organization? Third is you can explore hosting an online event or auction. So organizations have thought about how do we move our gala? How do we move our fundraising event online? Is that something that would benefit your organization? Peer-to-peer fundraising, social media fundraising, exploring new grant opportunities. So every day I'm seeing emergency grant opportunities popping up. To what extent are you aware of those? This is a great opportunity to thank your donors for their past support. Your support has allowed us to weather this storm to this point. Your support has allowed us to provide direct services during this time of crisis. Again, focusing on communication with donors during this period. I mentioned urgent need funds. So another way that your board can be helpful, particularly if you also have a development team or if you have a development committee at the board level, is understanding what resources exist in your local community. So for many communities, whether it be a United Way or whether it be a community foundation, there are entities that exist that have created emergency funds or urgent need funds. To what extent can you apply for those or qualify for those as an organization? Second is being aware of entities like the Council on Foundations. So to date, there are more than 400 philanthropic foundations that have taken a pledge that was published by the Council on Foundations that indicated that they were willing to be flexible in their grant making during a time of crisis. And this may vary per foundation, but things like relaxing grant applications, relaxing grant reporting deadlines, considering emergency grants or operational grants when they previously haven't done so, considering multi-year gifts or emergency gifts. So understanding what does the philanthropic landscape look like at a local level? How does that impact your ability to raise revenue during a time of crisis? Another area to pay attention to during this time, and I've been bullish on, is donor advised funds. So for many of you who understand donor advised funds, they were first created in the 1930s. They were recognized with the Tax Reform Act of 1969, began to grow in popularity in 1990. They are now philanthropy's fastest growing vehicle. They account for over 3% of all giving. So if you look just as recently as 2018, donor advised funds reached new highs in dollars distributed, dollars contributed, the value of their assets under management, and the number of accounts. So why is that important? What's important about that right now is for donors who have donor advised funds, those are gifts that they've already made to the donor advised fund. They've already received the tax benefit from those gifts. Those funds are sitting in an account at the community foundation or at a Fidelity charitable or Schwab charitable. Those gifts have already been made. So to the extent that your donors themselves may be feeling a financial pinch themselves personally during the crisis, those are gifts that have already been made that are outside of their control, that can be then granted and gifted out to the community. So one of the things that I see effective nonprofit organizations doing right now is taking a really targeted look at their donor database, taking a look at their donor list and saying, who typically gives from donor advised funds? Can we have a special conversation with them that talks about whether they may have any funds accessible in their donor advised fund, their DAF, that may benefit our organization, that may help us get through this crisis period. Third is area of board financial concern right now is balanced decision making. So what differentiates us as nonprofit organizations from for-profit organizations? And it's principally that the board's role has to balance both impact and finances in making decisions. So as a board, as you're weighing financial implications, as you're weighing things like our resources that we have on hand, the need to maybe furlough or let employees go, it's about balancing what does that do to the impact? What does that do to the mission, the character of our organization, in addition to the financial concerns? Fourth is ensure that voices are heard. There are some really practical things that boards can do during this period to broaden their access to information. So for many boards, they have policies that, for example, staff may not attend board meetings, or other than the executive director, the CEO, staff may not attend board meetings. But this is a time where information is key. Information is currency right now. So how can we get those voices of staff, of volunteers, of community members, of philanthropy that are so vital in times of crisis? How can we get their voices, their information of what they're seeing and hearing on the front lines in front of our board? So as a board, as an executive director, this is a time to ask critical questions of, for this period, do we need to broaden the voices that are in the boardroom? Do we need to invite staff to make a presentation to the board that shares what they're seeing on a daily basis? Is this a time where we need rigidity to the way we've always done things? Or is this a time where we need to consider an alternate approach that broadens the spectrum of voices that our board is hearing from? And then fifth and finally in the finance realm is advocacy. So I mentioned the Families First Act, the CARES Act. Certainly at a state level, legislation is being passed very quickly. At a local level, there are different responses. Understanding the board's role in advocacy, this ties back into our communication planning earlier, but how to leverage the board, or how from the board chair's perspective, you can leverage the unique skills and talents of the board to be a voice for the organization to local, state, and even federal decision makers during this time. As we wrap up, I mentioned that there would be likely further stimulus packages coming down the pike. Understanding what is the nonprofit's best case to be included in those stimulus packages. They were obviously included in the payroll protection program, but remembering that nonprofits are significant employers. So these can be talking points for your board as they go out and advocate for the organization. Nonprofits are essentially small businesses. Nonprofits are on the front lines of this crisis every single day. Nonprofits are experiencing declining revenues, and significantly, particularly at the federal level, nonprofits are in every single community around the country. So when Congress passes a piece of legislation and the president signs it that benefits nonprofits, it's a piece of legislation that's benefiting the entire country and every community within the country. So I mentioned earlier that before we wrap up, we would touch on board engagement, some tips for board engagement. Important is critical leadership from the board chair during this period. It is extraordinarily difficult for an executive director to lead a board during any time, but particularly when it comes to a time of crisis, that partnership between the board chair and the executive director is vital. having those conversations, when it is supported and led by the board chair, it adds a different dimension. It adds a different level of gravity. Second, focus on small actionable steps for the board. So I have seen a lot of communications come out from nonprofit executives to boards saying, we need help during this time. We need you to engage during this time. But again, the more you can focus on small actionable steps that are within the sphere of control of your board, that can be coordinated at the board level, the more likely you are to get engagement from individual board members. Third, and every organization is going to answer this differently, balance committees versus the full board. So ask the question at the board level, will we function more effectively as a team right now working through our existing or ad hoc committees? Or will we function more effectively functioning as a board of the whole and streamlining communication? And I'm not saying that there's any right or wrong answer there, because it's truthfully going to be different for every organization. What's most important is having that conversation as a team that says, are we going to be more effective functioning through our committee structure, or are we going to be more effective on a short-term basis functioning as a board of the whole? Fourth is managing board frequency. I am never a proponent of suspending your bylaws, but if, for example, your bylaws say that you meet as a board quarterly, this may be a time to re-examine that. This may be a time that says, for a short period of time, we need to have a more frequent, even a shorter meeting that keeps everybody up to date, that keeps the lines of communication open. And then fifth, and critically important, is managing the virtual meeting. So we are going to be operating in this virtual environment. Many of us have not had training on facilitating a virtual meeting. What will be most effective for your board in meeting? Do you need to engage with an external facilitator to manage the technology piece, to manage the facilitation piece, to make sure that voices are heard around the table, and allow the CEO, the executive director, and the board chair to focus on the content and the agenda of the meeting, and leave the facilitation piece for someone who does that more regularly? What's going to be most effective for your nonprofit organization? So at this point, we've reached the end of our webinar time. I do want to open it up to any additional questions that you may have. You see on the last slide, as I give you an opportunity for any additional questions to come in, my name, my contact information, my email address is gregory@nielsenconsults.com. I welcome you emailing me with any specific comments or questions or concerns that you may have. My website is nielsenconsults.com. You can also find me on social media, on Facebook, on LinkedIn, and on Twitter. I welcome folks connecting with me that way, and also my phone number there on the bottom of the slide. I want to take a couple of questions that we have that are coming in right now before we wrap up. A couple of people asking, will the slides be available? I am not sure about that. I'll tell you, this is my first time using this Zoom platform on the webinar side. If I can make the slides available to those who have attended, I will. I just ask that you keep those yourself and don't disseminate those more widely than those who've been registered on the webinar. Access to the presentation and recording. I have several people asking if the recording itself will be accessible. If that's something that will be helpful to you, I am recording the webinar. And again, if I can manage the technology myself, I will send out an email to those who participated on the webinar today with the recording information. With that, we've reached 2 o'clock Eastern time here in the United States. I want to thank everybody for participating in the webinar. I know lots of you have to jump off now. I do encourage you to reach out if I can be helpful to you in any other way. And to our nonprofit leaders and board members on the call, thank you for all that you're doing during this time. I appreciate you. We see you. You're not alone. There are resources out there to help you. Thank you. Stay safe and stay well.